So this is titled Adjusting Institutions for Longer Lifetimes. And let me start off by saying, I think if we did a survey of what are the big problems facing the economy in the 21st century, I predict that the following four would be the top four. People would say moving away from fossil fuels / climate change is a big issue. They would say controlling healthcare costs is a big issue. Relatedly, they would say getting the budget under control and entitlement programs under control is a big issue. And today they might say inequality is a big issue. I think those would be the top four. And I want to propose that adjusting our institutions, and by and large I mean retirement institutions, for the fact that we're living longer is a big issue for the first half of the 21st century, if not longer. So the first thing to talk about on this topic is, are we deluding ourselves? Are people really living that much longer? Or does that just make us feel good? So let's look at the facts. And so this particular chart that I put up there now shows the probability of 65-year-olds in 1955 celebrating future birthdays. And what you see is 65-year-olds in 1955 had a 50-50 chance of living 12 and a half more years. And I should be working for Hallmark, since I think we should celebrate half birthdays. But 12 and a half years was your 50-50 marker in 1955. And you had a 50-50 chance of that. You had about a 20% chance of living 20 years and reaching 85. And you had actually a fairly low chance, 8.8% chance of reaching 90. This is for men. We'll do women in a minute. So these 65-year-olds in 1955, a representative of that class would be Dwight Eisenhower, who some of you may know had a heart attack 3 weeks before his 65th birthday. This picture is before his heart attack. And if you don't follow U.S. presidents, but you watch a lot of television, it's also Groucho Marx was 65 in 1955. But anyway, this gives you the surviving probabilities of 65-year-olds in 1955. Now I'm going to put the surviving probabilities for 65-year-olds today. And at the top there you see that 77.5, that 12.5 years longer, it's no longer 50%, it's 75% likely that you'll live another 12.5 years. And it's actually, the 50-50 marker is now 85, 20 years in the future. You have a 50-50 chance of celebrating a birthday 20 years after your 65th birthday, and that indeed would be your 85th birthday. And you have a 30% chance, not 8.8%, of celebrating your 90th birthday. These are Social Security's so-called intermediate forecast statistics. So Kate said, well, we're not living forever, we're living a lot longer. In fact, that 50-50 marker, well, 12.5 years has grown to 20. That's a 60% growth in 2 generations. And how long the median person lives, how much longer the median 65-year-old lives. 60% longer in 2014 than 1955. So I think over 2 generations, these 2 years are only 2 generations apart. To live 60% longer is amazing. Now, who would be 65 this year? A man. Well, Bruce Springsteen is 65. So now let's look at the women. And The green line is women in 1955, and the purple line is women today, in 2014, 65-year-old women today. What you see, 65-year-olds today have a 40% chance of reaching 90. They reach 88 with about a 50-50 chance. By the way, in 1955, reaching 100 was really, really rare. Social Security believes that today's 65-year-old women have actually a 5.6% chance of reaching 100. So these are remarkably longer lifetimes. And who were these 65-year-old women? Well, I picked out a couple. I cheated a little bit because Agatha Christie is not an American, but she's a well-known person who turned 65 in 1955. That's her with her grandchild. And then there's that other 65-year-old that you saw at the Oscars recently, Meryl Streep. So they're the same age. So these four people are all the same age, or are they? So that's the question. Are these four people really the same age? And so I'm saying the right answer is no, they're not the same age, but they're all 65. But 65-year-olds in 2014 are not the same age as 65-year-olds in 1955. So I'm saying it is true, we are living a lot longer. And so then what are we going to do about it in terms of retirement institutions? Now, I've been talking about men and women, but let me talk about couples. And there's a lot of numbers here. But let's talk about the third row. What the third row refers to is a couple, a 64-year-old man and a 62-year-old woman who are thinking of, or maybe not thinking of, they are going to retire. And actually, that is the average age of retirement for men and women, 64 and 62. And the real question is, well, how much longer are they going to live? And if you're a couple, well, you've got 2 deaths to anticipate. So when's the likely first death? And when is the likely second death? And you can see what the numbers are. The first death is a little more than 16 years in the future. The second death, on average, is about 27 and a half years in the future. The survivor, on average, outlives their spouse by 11 years. Widowhood is actually a long stage of life. And then what are those pesky numbers in parentheses? So you see numbers like 35 on the second death. Well, that's how long until the second death, if you're a little bit lucky, and you outlive 90% of your cohort, but 10% outlives you. So you have the 10th percentile luck, good luck, but not at the extreme tail, 35 years of retired life. That's a long time to support yourself without a paycheck. So what can we make from all of this? Well, I'm saying, I already told you, the average age of retirement today, 64 for men, 62 for women. At those ages, I think people, particularly married couples, need to be prepared for 30 years or more of retirement. They may not be 10th percentile lucky, but that's 35 years. But they need to be prepared for at least 30 years of retirement. I put down once again that widowhood, which is not always the woman out surviving the man, sometimes the widower, but that's a long stage of life, on average 11 years. But my main point is you can't finance 30-year retirements with 40-year careers. It won't work. You try to figure out how much you would have to save to finance 70 years of consumption with 40 years of work. It's not an American level of savings. So it just won't work. And that has something to do with why these cities are going bankrupt. It's a worldwide phenomenon. It has some of the problems in Southern Europe are these retirement ages are ridiculous. and the pension obligations are ridiculous. So what are we going to do about it if it won't work? Well, I think the easiest thing to do, well, by the way, the consequences are, and this isn't the only driver, but this is a partial driver behind the vastly underfunded state and local pension plans. It's a partial driver for why we think the Social Security Trust Fund is going to run out of money in 2033. Certainly it means, because we're retiring at these ages, we have more retirees relative to workers than we otherwise would have. By the way, compared to 1955, people are living longer, as we just saw. They're actually retiring earlier. So the growth of their retirement is more than the growth of their life. Compared to 1955, people retire earlier and live a lot longer, and so we have this really long 30-year retirement to deal with. And it lowers standards of living, but it also causes tremendous financial disruption. So what could we do about it? Well, the easiest answer, I think, is simply work longer. But both sides of that market need to think about this. The trend is, the recent trend, is that people actually do want to work a little longer than they did 5 years ago, 10 years ago, even 20 years ago. That trend needs to continue, but I think firms have to get behind this too. We have to get employers to figure out how to effectively use workers in their 60s. And they also need to come to grips with the fact that 65-year-olds are a lot younger than they used to be, and a lot more productive, and they can add more value to the firm. But anyway, I do think we need a national conversation about how to divide adult life between work and retirement. For instance, if you think that there's at least 70 years of adult life, a 48-year career with a 22-year retirement might have a chance. And a 22-year retirement would not be a shorter retirement than those people in 1955 were enjoying. We're not saying we have to have a shorter retirement. It's just that we cannot take all of our extra life and more in retirement and work less. So I think today's Stanford students, for instance, should anticipate working at least until 70. By the way, even though my plan is in 18 months to step down from running SIEPR, I'm not retiring. So I'm going to live it myself. Okay, so what else could we do besides working longer? Well, we could get rid of all these hidden early retirement incentives that we have now. And George Schultz and I wrote a book. I think there were 3 readers in the world of our book, but we had a couple of what we thought were pretty good ideas. And one of the good ideas was to change Social Security and the way its benefits are calculated and the way its taxes are collected. Right now, Social Security only keeps track of, or only counts towards your benefits 35 years of work. And many people reach 35 years of work in their mid-50s. And after that, Social Security keeps taking your taxes, your payroll taxes, but it quickly becomes a pure tax on work. Your benefits are not enhanced by further work. So that seems like these people in their late 50s and 60s, Social Security presents the following deal for them. If you work, you can pay taxes, but it won't improve your benefits. This is a pure tax on work. So we had the idea of counting 40 years instead of 35. And then after 40, we were going to come up with a new category of worker who we called the paid-up worker. Paid up means that if you've paid in to Social Security and Medicare for 40 years, you're lifetime paid up. And you can continue to work, and it won't help improve your benefits, but there will be no payroll tax, neither for Social Security nor for Medicare, not for you and not for your employer. So that would make, for both the employer and the employee, working beyond 40 years more attractive if you could do so without a 15.3% tax in between what you cost the employer and what you bring home, at least in before income tax income. So the paid-up worker was an idea, and basically that's removing a early retirement incentive, and we need to remove it. Second idea is the following. Medicare also has an early retirement incentive. It's not very well known, but the way Medicare works, if you're 65, you get Medicare. Very valuable, major medical, hospital insurance, and so forth. In fact, the hospital insurance is free. You get it unless you work. If you work, and there's some details for an employer with more than 20 employees, then you don't get Medicare. Your employer's plan has to cover you, and you and your employer will jointly pay for your health coverage. In other words, if you don't work, we'll give you health care, and if you do work, we won't. As to what the government's plan is, well, that's a tax on work, a big tax on work. I don't know if it's $10,000, $12,000 tax on work, which is, they take away something that you would have had that was worth $10,000 or $12,000 if you hadn't worked. So they call this Medicare as a secondary payer. What that means is Medicare stands behind your employer-provided health care. Behind means they don't pay. And what we suggested is Medicare take a primary role. We call it Medicare as a primary payer. And that means you get Medicare at 65, whether you work or not. So just imagine you go to your employer and says, I know you're used to people in their late 60s costing your health care plan a lot, but I don't cost your health care plan a lot because I have Medicare. Well, they'd be much more inclined to hire you. So that's an idea. And you might say, well, that must be complicated. It might not work. Well, guess what? That's how it worked from 1965 to 1983. So we had Medicare as a primary payer, and we switched, and that was a mistake. Here's a third change. This is one it wasn't in our book, but I think and this is really kind of a behavioral economics idea. Social Security has this odd rule that, well, it's not, this part's not odd. The later you start claiming Social Security, the more you get. So if you get it at 62, you get a certain amount. If you wait till 66, you get more. If you wait till 70, you get more. This table shows you how much you get. So the least you can get is 62, and the most you can get is if you wait till 70 to start your Social Security. What's odd is they kind of declare that 66 is your full retirement age. Well, what sense is that the full retirement age? You get more if you wait till 70. Why don't we call the full retirement age where you get the most? Just change the words. Don't change the schedule. So anybody who retires before 70 is an early retiree. And they're not getting the full benefits. They're getting less than the full benefits, less than they could get if they waited. So that's just changing the words. But I think a lesson of behavioral economics is words matter. And so I don't know how much they matter, but they matter. So the idea here is, why not have the full retirement age correspond to the maximum monthly benefit? I think in many people's mind, full retirement age must mean that's as much as I can get. Why would I work beyond the full retirement age? If you learn the details, there is a reason to work beyond the retirement age, but you might be confused by the words. So I'm about wrapped up. I just want to go through the following. This is just a summary. I think we need to change institutions for the fact that people in their 60s, particularly married couples, are going to be around for another 30 years with high likelihood. And I honestly don't think we can divide adult life that way. I think they're going to have to work through their 60s and enjoy 20 or 22-year retirements and not 30-year retirements. They have to work longer. And so my idea is we need to change institutions to encourage them to work longer. And I've mentioned 3 possible ideas, but we need more ideas. One idea is the paid-up idea that I described. The other idea is change Medicare, as I described. The third idea is just change the semantics of Social Security and say that 70 really is the full retirement age. Another thing we could do and should do, figure out how to do it, is have a conversation about how we can have more part-time work for senior workers. And that needs to be a conversation led by the White House and perhaps Congress. Hard to imagine them leading on anything, but but it needs to be with employers and so forth. I think a lot of seniors are interested in working. Maybe they don't want to work full-time. So we need to see if we can figure out how to productively arrange that. Now, if you're living so long and working so long, it's hard to believe that your education is completed at 21. So another thing we need to do is have a robust program of retraining workers for the second half of their career. It makes perfectly good sense if you're going to work till 70 to get another shot of education at age 50. And I think that's another aspect. The last thing I'll mention is we don't hold up Japan as a model often these days, but the Japanese live longer than Americans. They live 4 years longer on average than Americans. Guess what? They have shorter, not longer, retirements than Americans. Now, the only way that works is they work a lot longer than Americans, but we need to look at how that works in Japan. I don't know the details of how it works in Japan, but it clearly is a different situation. They have one of the shorter lengths of retirement, and they have the longest lifetimes of all developed countries, or maybe anywhere in the world. So I just wanted to also confirm that economics is the dismal science by saying that only economists could convert living longer into a problem.
That's good. It is a pleasure to join you all this morning and to talk about what I think is one of the most important challenges that the U.S. and the developed economies of the world will face over the course of the next half century. There is an old adage that says that one mother can take care of 8 children, but 8 children can't take care of one mother. Which suggests that it's not just public institutions that are likely to require some thinking and analysis as we face this older population going forward. But I think it dramatizes the role that a whole host of different institutions will face as we see this shifting of the age structure in the US and elsewhere. I, by and large, agree with the broad outline of what John has provided in terms of suggesting the imperative of rethinking a number of institutions which encourage people to drop out of the labor force at earlier ages than they might otherwise choose. What I'm going to focus on this morning is essentially adding a little bit more texture to some of the things that John's talked about and telling you that in a number of ways it's just a little more complicated than the story that you've just heard. And in particular, I'm going to highlight heterogeneity in the aging and elderly population. Heterogeneity in a number of different dimensions, in life expectancy, in health status, in financial preparation for retirement, and in both their income structure and their wealth, that I think just as you think about the institutional reforms may give you a grounding in how this may be a little more complicated than just everybody's going to work to 70 as we go forward. So I want to start by taking on the key issue about the changing life expectancies. And the numbers you've seen are basically the numbers for the population at large. But it turns out that there is substantial divergence within the population in how much longer people are living. Okay, this chart, which I find quite striking, was created by the Social Security Administration. Okay? I don't have the photos of the members of these cohorts, and I'll have to get those for my next outing. But this is basically looking at folks, men, US men, who were born between 1912 and 1941. Okay? And in each of these cohorts, the Social Security Administration, one researcher there, Hillary Waldron, ranked people in the top and bottom half of the income distribution by the earnings that Social Security saw reported. Okay? And then looked at age 65 at life expectancy going forward. Right? So these are for people who basically turned 65 in 1977 for the top cohort, in 2006 for the bottom cohort, and in some cases, of course, there's a need to make some extrapolations of what's going on. But you can see what the SSA discovers, and the SSA knows when people die, because they learn and they stop the SSA benefits. Okay? What you discover is that for those in the top half of the income distribution, over this period of only about 30 years, life expectancy for those men increased by approximately 6 years. For those in the bottom half of the distribution, the increase was only 1.3 years. Okay? So what it immediately triggers for you is you got to think about what's happening to places in the different spots in the distribution, because the policies that are suggesting we are thinking about very long retirement spans are appropriate for one group, but maybe not quite as appropriate for the other. Okay. Now, for the folks in this room who are mostly in the upper half of the distribution, this is not only good news because it means life expectancies are longer, it means you have to take what John told you earlier and square it. Because if a bunch of folks aren't living as long as those population averages suggest, a bunch of folks are living a lot longer. Okay? And what this suggests is actually for the highly educated, high-income groups, the improvements that we're seeing may actually be even larger than what the aggregates suggest. There is, by the way, respectable demographic evidence, not consensus, but respectable, to suggest that the life expectancy for a newborn American girl may be close to 100 years. That's not what the Social Security Administration assumes. It's significantly longer. It's about 15 years longer. But there's at least a reasonable possibility that even the numbers that we've been talking about today are understatements about the kind of progress and the kind of changes we may see going forward. But tables like this, and this is sometimes called the mortality gradient by folks in the policy world, these numbers suggest that thinking about what you do for those who may not have the longer life expectancy run and how the institutions can flexibly adapt to those heterogeneities may be very important. Okay? You see something similar if you look at diseases and health status. Okay. They're measures of disability. They're really hard to quite judge in terms of what they mean. But this is just some simple information that Jim Smith of the Rand Corporation has put together on disease incidence. Okay. In each of these columns, what it shows you is the ratio of the incidence of the disease for people who have less than a high school education to those in the denominator who have more than a college education or beyond. Okay. What you find is that for, say, heart attacks between 55 and 69, those in the lower education tier, twice as likely to have a heart attack as those at the top. Move out to the 70 to 84 category, 1.6 times as likely. The only place where you see the higher education tranche having a lower likelihood, having a higher likelihood of ending up with one of these ailments is the cancer group beyond age 70. Okay, and that, of course, may reflect something about the mix of who's actually living into that group and not affected by those earlier ailments or things that might have affected longevity there. So, and this, we don't have ideal data, but this maps into various things like disability status and capacity for additional work. So it all sort of paints a picture in which you've got a group that is very likely to be in very good shape as they come into their 60s and even 70s, and another group that may be much less able to handle these longer work lives than we've seen before. Again, pointing toward this, we need to think about flexible institutions. What about changing the nature of Social Security benefits and other things like that? These pie charts, which may be a little hard to read in the back, but I'll try to explain what they show, look at, for individuals in 2013, this is the entire 65 plus population in the US. These look at the sources of income for these folks, bottom quartile of the income distribution, top quartile of the income distribution. The bottom quartile, which is the group that's on the left, what you see is that the vast majority of their income is just coming from Social Security. Okay? So when we talk about modifications to Social Security benefits or changing cost of living formulas and things like that, for this part of the group, that translates pretty directly into changes in their total income available. Now, and by the way, the next quartile up from that group looks reasonably similar. Okay? So it may mean that as we think about means testing or something like that, schemes which basically have the effect of changing these benefits differentially at different points in the income distribution may be relatively attractive by comparison to things which change them everywhere. You look at the top end, the top quartile, what you discover is that earnings are actually a significant part of the income stream, even for those over the age of 65. Okay? They account for something on the order, and this is sort of telling you that there's a substantial group that's actually continuing to work beyond the age of 65. And I think that's an underappreciated fact when we look at a lot of the data on sources of income and retirement work. So you realize that this group actually is doing something which is much more like the textbook story that those of you who studied economics as undergraduates learned, where people were accumulating assets assets as they approached retirement. They were using those assets to support retirement. They have asset income. They have pension income. They have earnings in many cases. They have a much more diversified mix of resources to get them through their retirement years than those who were at the bottom end of the distribution. And at least it suggests to me that in the very near term, at least while we're sort of taking these folks as they are and thinking about how the system will change, we have to confront the reality that there are lots of folks at the bottom who don't have much besides their current Social Security to rely on. You can see the same fact, by the way, if you look at the wealth distribution. In this chart, which is a little complicated, but captures for what it does is it looks at the columns in this chart look at different sources of wealth that households might have as they approach this is for 65 to 69-year-olds, just before the Great Recession. Okay, and what it's stratifying people according to their percentile of the distribution. It's doing it in each column separately. So this is why when you look across the rows, things don't add up, because we're looking at who's in the 10th percentile of the Social Security wealth distribution, the non-retirement financial asset distribution, the IRA wealth distribution, and then the last column is saying net worth altogether. Okay, so but they're separate rankings. Okay, but the key thing to notice is that there are lots of zeros in the lower tranches of this distribution. Right? You look in the middle of this table where you're looking at defined benefit pension wealth, non-retirement financial assets, and IRAs and defined contribution plans. Until the 30th percentile of the distribution, they're basically zeros. Even at the median, right, they are close to zero. There's just not much there. Then you get up to the top end of the distribution, the top quartile, the top 10%. There you've got a group that's actually built up substantial capacity. So this suggests to me, and that if we're going to prepare for the kind of longer retirement years that we are likely to see in the future, we have to think about not just changing the institutions, but making them effective in a way that we can actually encourage more retirement saving and other kinds of preparation for these longer retirement spans that we're going to see. So I do think that, in fact, this sort of sets the stage for some of these institutional discussions. This also reminds you, okay, when you realize that the wealth levels for much of the population are quite low. Many of you probably heard that during the Great Recession, 401k balances had declined, wealth had declined on a variety of different dimensions, and discussions about how that was leading to longer retirement. Okay? It is true that as wealth falls, people tend to try to work longer to rebuild their balance sheet. Okay? But there were two things that happened during the Great Recession. One was that unemployment went way up, and the other is that balance sheets got weaker. When people try to study the relative magnitude of these two things, this is Courtney Coyle and Phil Levine at Wellesley who've done this, what they find is that the unemployment effect dominates the wealth effect. Why? Because the higher unemployment rates affected most of the distribution. The decline in equity values in particular only crop up for those near the top of the distribution who have a substantial balance. So in fact, on average, the Great Recession probably led to lower labor force, not higher labor force activity in its own right amongst the elder part of the population. Okay. Now, I do want to move on to look at the actual labor force participation rates. And John alluded to this in his presentation, right? The fact that people are starting to work longer. They're actually working a lot longer when you look at this, right? This is a chart. The upper line is men, the lower is women. This is labor force participation between 65 and 69. Between about 1991, when we hit the low point for this for men, and today, labor force participation rate in this group has gone up by over 10 percentage points. Okay. I think there's actually an optimistic note here, because I think one should not be fatalistic in thinking that we can't change institutions and behavior on a horizon of a couple of decades, which is, in some ways what John was teeing up for us. Right? You do this again, for another 20 years, and you see a very different economy for the older group of the population than you saw in the 1990s or 1980s. Okay. Now, this trend, and of course, men and women are different in this regard. Women, there's a gradual increase in labor force participation for those who were in the older groups, because we're seeing cohorts that had higher labor force participation all along the way coming into the, quote, retirement years. For men, there has actually been a turnaround in the labor force participation at some of these advanced ages. Okay? Now, I'm an economist, so you look at a chart like this and you say, is it supply or is it demand? And the answer is, we can't tell. Right? It could be that people are working longer because they don't have the wherewithal to retire, and the shift from defined benefit plans to defined contribution, a variety of other things have led them to think they must work longer. Or it could be that they're working longer because they're healthier and they're feeling that they enjoy doing it. Economists are always nervous relying on survey evidence of any kind when you ask people what they think. But the AARP did a survey recently which asked those at the upper end of the baby boom cohort whether they were planning to retire and what they thought about working longer. And about 31% of them said that they wanted to work longer because they enjoyed their work. Okay. Another 20% said they felt that they needed to do something that would be interesting, and that was that they didn't love their work that much, but it seemed good relative to the alternatives. So that's about half the group. About 30% said they thought they'd work longer, but it was because they didn't have the wherewithal to retire otherwise. They needed the money. So you don't know exactly what that means, but I think that this is a situation where there's some heterogeneity in what people are doing in terms of the behaviors that are out there. If you look beyond these age groups and run the distribution out, and now as I look with George Schultz and Vic Fuchs and Ted Anderson in the room, even at the age of 85 plus, and I couldn't get 90 plus because the samples in the data set I was looking at were too small, and I apologize to those three. But for 85 plus in the US today, 6% of men are still in the labor force. Okay? For 75 to 80, the number's about 16%. Okay, so there's a tail out there that's actually doing meaningful earning and meaningful labor force activity. And of course, it pivots on what John was saying earlier, which is kind of changing the mix of what's there. I want to say one more thing, though, about this shift for the men, which I think is an intriguing perspective on what's happened in the US economy. I'm going to take you down a little, a slightly ethereal calculation here, and it pivots on John's discussion about with these 65-year-olds. Think about a 65-year-old man. And ask the question, how many years on average will that person continue to work, and how many years of non-work will they have on average before they die? Okay? So I'm just taking the numbers on labor force participation and I'm integrating them with the information on mortality rates to come up with expected years of work and expected years of non-work. Okay? And this is looking at what this has been like for people who turned 65 beginning in 1975 and finishing basically at around now, I project 2015. Okay. For a man who was reaching 65 in 1975, he had about 2.9 years of expected work and 11.5 years of expected non-work. Okay. Now, John's shown you the dramatic changes in life expectancies that take place. In the next 2 decades, okay, the 65-year-olds coming along behind added over 2 years of non-work and actually subtracted about half a year of work from what they were expecting to do beyond age 65. But after about 1995, this turns around. And we've seen continued improvements in life expectancy, but the growth in labor force participation has basically moved along in such a way that the growth in years of work has been about 1.5 years since then. The growth of years of non-work is de minimis. It's about 0.2 of a year. Okay? So we are in a period already when the life expectancy improvements we've seen in basically the last 20 years are being absorbed by additional labor market activity for the men. For women, the pattern looks a bit different. For women, the expected work has been rising through this period, and the expected non-work is basically constant. And what that's telling you is that these cohort effects of the more labor market connected women have basically been canceling out the effect of the life expectancy improvements. So what this suggests is that there's tremendous fluidity in what's happening, and that while we talk a lot about the life expectancy improvements, these changes in labor market activity are in and of their own right a really important consideration to think about as we see what's happening. So I've talked a lot about labor now. I'm going to close for just a couple of minutes by talking about capital, talking about the savings side of this. Right? You saw the chart that shows that a lot of these households have very low levels of wealth as they approach retirement. And the challenge, of course, is what do we do about it? How can we think about moving the wealth accumulation levels up for this group? The U.S. retirement structure for folks outside the public sector has largely evolved over the last 25 years from a defined benefit world with the pension that paid you an annuity based on your years of service and your career earnings to one that's largely defined contribution, 401k type model. And there are many who beat up the 401k type model. I'm not one of them. And I think it's actually got the capacity to do many, many good things. But it does have as one of its intrinsic features as currently operating a lot of ways for households to fall off the track of making an acceptable level of retirement accumulation. Okay, so I just list a few of sort of the failure points that one can have, right? You need to work for an employer who offers a retirement plan like a 401k. You need to decide to participate in the 401k conditional on it being offered. You need to avoid early withdrawals if you change jobs or if you run into a pattern of financial hardship and you can take a loan, you need to put the money back in. Okay? You need to think about how you're drawing the money out when you get to retirement and avoid something like a rapid spend down in your early 60s and stretch the money out for a longer time. And these are all hard problems for many households to confront. Okay? And in an audience like this, finance, economics aficionados, it's important to remind ourselves that not everybody enjoys taking a present discounted value. Not everybody thinks that compound interest is one of the great miracles of the world and understands the power of exponential growth. Okay? And in fact, a lot of people think that thinking about money is really, really awkward, and they don't like doing it very much. Okay? And this, you can take this in different ways, but one way to describe this is just that financial literacy at some level is not great in the US population. The standard data source that a lot of us who work on the economics of aging use is something called the Health and Retirement Study. And these are 3 questions taken from a module on financial literacy that was fielded to people who were in their 60s and 70s a couple of years ago. And it asks you 3 questions, as you can see, right? You earn 2% a year for 5 years on $100. How much do you have? More than $102, less than or equal to less than $102, or equal to 102? About 2/3 of the people get the answer to that question correct. Okay? Second one, okay, inflation question. Okay, now you have to do the macro part as well, right? 1% yield on your account, 2% inflation. In a year, do you have more or less buying power? Okay, 3/4 get that one right, but the other quarter don't. Okay. True or false? Okay, I know that here the answer on the East Coast and the West Coast may be different. Especially in Silicon Valley. But buying a single company stock is more or less risky than a share of a mutual fund. About half get what I'll call the textbook answer, which is that the mutual fund is the less risky investment under the circumstance. Okay? How many get the trifecta, all 3? Only 1/3. Okay? Now, you take this fact and you then think, we're trying to convince them they're living longer and they need to save more. You got to get them to somehow put these pieces of information together in a way that enables them to take action and understand the implications of these additional years and understand what this is all going to translate into. And that, I think, is a pretty substantial challenge. If you do a little calculation, which for anybody in this room would be a back-of-the-envelope calculation, and say I'm going to work for 30 years, I'm going to save 1% of my salary every year, take my salary as flat just to keep the calculation simple, okay? I'm going to get a 4% rate of return in every year that I save. 4% in tips. Imagine that. And what am I going to have at the end of my 30 years of working and saving? I'll have an accumulation that's about half the value of my salary when I retire. Okay? So if I think, if John would be able to tell me how many times my salary I needed to build up, I can map that into how many percentage points of my earnings do I have to save. You want an extra 3 points of payout, you want an extra 3 times of salary when you get to retirement, you're going to have to save an additional 6 percentage points of your income along the way. Okay? The group that doesn't get the answers to these questions is not going to do well at trying to figure out the answers to those questions. So I think what this sort of leads to, and John closed on some of this, is thinking about behavioral economics and various kind of nudges and other strategies, which may be helpful for the part of the population that does not have sharp pencils and does not think hard about these questions. So this chart, which I think of as a pretty optimistic chart, shows the effect. These are some 401k participation rates associated with default options in 401k plans. Okay, and today many of you, I'm sure know that many 401ks have moved toward a model where when you sign up, when you join the firm, you're automatically enrolled in the plan. And I just want to note the economists did not do themselves proud with analyzing ex ante how these types of plans would work, right? Because what you're asking is, the new worker comes in and you say, we have a 401k plan, here's the details, and you can sign up and check the box here that you'd like to be in the plan, and then you can tell us how many % of your salary you'd like to contribute. Okay? Contrast that with, we hand you the same package of paper and the box says, we've signed you up to contribute to the plan 4% a year unless you check this box that says you'd like something else and then put the number on that line. Okay? Now economists think of this as the budget constraints the same, the indifference curves are the same, the people are the same, the outcomes have to be the same, right? This can't matter, okay? You do it in the real world, and you go from participation rate at firms A, B, and C in this study by a collection of researchers, 38%, 40%, and 50% participation rates give way to 96, 85, and 97% participation rates for new employees when you do it with the you're in unless you check the box that says you're out. Okay. Well, this is, leaving aside for the moment the fact that this is a fundamental stake in the heart to a whole bunch of neoclassical economics that I hold dear, this suggests that we have some tools which might be useful for trying to bump up the accumulation and the savings rates. Now, there's another whole talk to be given on why this is more complicated too, because one of the challenges is that when you default people into a plan, you have to figure out where you're going to put them in the default, and it turns out that they are very sticky. So if you put them into a default, in the old days it was often a money market fund, right? They tended to stay in the money market fund for a long time. Today they're often defaulted into a target date fund, but then of course the question is that the right thing for them to be holding, and how should they think about that question? So, you know, what all of this, though, points to is the kind of creative designs that I think one can potentially turn to that may be able to address some of the questions that we are facing here. And this is actually an example of something which has spread and diffused quite widely. Vanguard has done some tabulations of their plan universe, and about 20% of their plans have automatic enrollment like this. About 60% of the workers that they enroll have an auto default plan. And what that suggests is that the bigger employers, of course, are the ones who have embraced this more quickly. Where does this all leave us? I think, you know, we do have to emphasize what John said at the end, which is that the remarkable improvement of human longevity in the course of the last half century or century is truly something to be overjoyed about, right? This is great news. And what we have to figure out is just how we avoid managing to let the economics of institutions that were designed, frankly, for a different era, manage to turn that into a substantial drag as we go forward. John alluded, as he said his list at the beginning of the 4 big questions we are facing, to the fiscal stresses and entitlement programs. Of course, that's all the same issue here, right? Thinking about how we address the longer lives is intimately related to solving some of the long-term entitlement challenges that we face. And I think from some of the evidence I've shown you today, that at least so far the private sector may be doing a little bit better at handling these challenges than the public sector is, but we've clearly got a lot of work to do on both dimensions. So thank you very much.
I want to add a very quick 4th question to the financial literacy question. Okay, true or false, you can solve this shortfall in pension availability in retiring early by writing and publishing murder mysteries. And let me assure you the answer to that is false if anybody's tempted. Okay, so John, do you have any comments on Jim's?
Well, I think Jim was absolutely right to emphasize the fact that there's a distribution of improved mortality, and we have mortality inequality as well as income and wealth inequality, and we need to figure out how to address that. Asking everybody to work longer is probably not the right solution. Thinking about how disability institutions should work might be part of the answer, but what I was suggesting is that we actually have some policies that penalize people who want to work a long time, and we should get rid of those. I think private companies should maybe get rid of those too, the early retirement incentives. Well, we have public early retirement incentives, and it's just crazy. Let me just say one thing related to the Affordable Care Act, just to relate it to the previous session. The Affordable Care Act, if you don't have employer-provided insurance, allows you to buy subsidized government subsidized insurance through these exchanges. That actually makes retiring before 65 more palatable, because today, before the Affordable Care Act, if you retired before age 65, you didn't have Medicare, you had a very poorly functioning individual purchase market, and so a lot of people held on to their job to wait to become Medicare eligible till 65. Now we have what amounts to a retiree health plan for people less than 65 years old. Because the subsidies go up to 400% of poverty, many early retirees we're actually encouraging early retirement again. I think the Affordable Care Act will cause people on average to retire about 6 months earlier, which I think is the wrong direction. So that was an unintended consequence. But if you're 62 now and you retire, you're in much better shape than if you were 62 3 years ago and retired, because you could get on subsidized health care. So there are connections here, but we need to have policies that encourage people to work longer, or at least don't encourage them to retire earlier. And we've added yet one more policy which encourages early retirement.
Jim, anything before I ask a question? Yeah, I think that's good. The question I've got is that listening to this, and there was a Wall Street Journal article on Tuesday about encouraging later retirement, and it seems so logical sitting here that the government ought to be finding ways to encourage longer work and later retirement. Doesn't necessarily have to spend money on it, but at least working to facilitate it. And it's not happening. It's clearly not happening. When that normally happens, you ask, well, who's lobbying on the other side of this? Who is it that is blocking the political solution? And are there such forces?
Well, in general, I don't think the AARP has been particularly progressive on these matters. But, you know, I don't think George and I have actually had a lot of people say on the paid-up idea, well, that's a bad idea, or that even Medicare as a primary payer, that's a bad idea. But I don't know what the inertia is that these ideas have not gotten
well, who gets
much
hurt?
Traction.
Who gets hurt if we start encouraging longer work lives?
Well, you know, I think if the pie were bigger, essentially nobody gets hurt. Now, if you required people to work longer, some people are going to get hurt. But if you just make it easier to work longer, I don't know that anybody gets hurt.
Yeah, I mean, I think it is very important to remember that we're in a group that really likes our jobs. And we probably, you know, academics are notorious for you have to really work to get them to retire at all, right? And so a lot of people in that bottom half of the distribution don't quite share that view of going to work in the morning. And they're the group that's being represented in many cases in these discussions that say, you know, making us work longer is a tax. It's hard. Now, you know, the problem at some level is this is often demagogued in a way that is just, is this a benefit cut, or is this you know, so you don't get into the fundamental arithmetic, which John laid out so eloquently, which just says it's really hard to make the numbers work if you don't try to move toward longer lifespans. The other part, which you know, George Schultz and John call attention to, and George has been talking about otherwise, is there's an intergenerational element of this, which is really important, in the sense that the longer you wait to move some of these goalposts for retirement and other things up in the distribution, the more the burden will fall on those who are younger and either working today or haven't even entered the labor force yet. Because unless you renege on the promises, we're going to end up finding some way to cover those costs, and it's going to be financed by the younger generation. So, you know, in some sense, the dialogue has not really gotten going in a coherent way yet, I don't think, that says many of these issues are about the set of intergenerational transfers that are playing out, and who's going to pay for, in some sense, the extra years of longevity without work that are going to be associated with those who've been the beneficiaries of this life expectancy enhancement.
Let me anticipate a question, because this group might not ask it, but I bet you would. Every other group always does. And it is, wow, if people are going to work longer, how are the young people going to get jobs? Right? That question comes up every single time. As if the economy, you know, only can produce so many jobs, and if one group takes them, the other group doesn't get them. And I just think that's completely backwards. I mean, I think of the economy as a machine, and the more capital and the more labor that are fed to that machine, the more output we get, the more income we have, the higher the standard of living. And so I don't think that if some people want to work longer, it means there are fewer jobs for other people. Now, there certainly might be a wage rate adjustment. If more people want to work, you presume that wages are going to be lower. But I don't think it means that in 2030, 2040, 2050, that young people are going to have a harder time finding a job because the older people are working longer.
It's the anti-immigrant law turned on its head.
Yeah, no, I very much agree with what John just said. And just to give you a little bit more flavor on that, there are countries that have changed their retirement ages in relatively short order by a couple of years. So you end up with significant changes in the labor force participation rates amongst the older population. And there have been careful studies of what the implications of that has been for the level of unemployment for those who are in their 20s, for example. And it's very much in the direction that John says. You don't find this kind of adverse spill-down effect for the younger groups. And in fact, you find, on average, larger economic activity and larger pie.
You reminded me, a classmate of John Lipsky and Gene Shanks and John Taylor's of mine here at Stanford. I once asked him when he's going to retire, and he said, "Why would I retire? I'm a professor."
I asked George Schultz, how long are you going to work? And he said, "I never worked a day in my life."
Yeah. Okay, a question back here. I don't know where the microphone people are. Oh, here we go.
I was born in the 40s, and pretty much everybody around us had 3 generations living at home. Is there any kind of policy assessments being made for the notion of benefits for congregate living for lower income grandparents? I mean, is there any way of anybody thinking about tax relief or anything like that?
I'm not aware of any proposals that are on the table. And you're right that this is something which has changed a lot. One of the first things that happened when Social Security benefits became substantial in the late 30s and into the 1950s, and they ramp up at that point, is the households unbundled. The middle-aged households stopped living with the parents, and I think a lot of people have interpreted this as this was not an arrangement that either generation was particularly enamored of, so that there was an income effect, and when you were wealthier, you basically chose to untie that knot. So whether that's necessarily the way to sort of try to put things back together is tricky. It is, there are, especially if you go to the lowest tier of the incomes of the elderly today, you do find many of them are living in households with their children or with other nieces, nephews. It complicates things, frankly, in trying to figure out measures of poverty and other things like that for the elderly. Because if you have an 85-year-old who's living in a household with her daughter and her son-in-law, how do you decide what the standard of living is for the 85-year-old? But this certainly is one margin of adjustment. And one of the things that when economists look at the data on the income and resources available to the elderly, it sometimes seems like it doesn't add up. Right? How are they doing what they're doing? And in many cases, I think the answer is effectively intra-family transfers of the kind that you're just describing, and moving in is the most extreme example.
One, in another but related area of work that I'm doing, I'm working on what you could call Social Security claiming strategies. That is, when should you initiate your Social Security? And one of the greatest benefits of getting that right is that widows or survivors can have more income. And if they had more income, actually that would benefit the children, and it would probably reduce the instances where the widow ends up being supported by the children and moving in with the children. I think people are using the wrong claiming strategy. They're claiming as soon as they can, and that doesn't work so well for the survivor.
Okay. I'm being forced to choose between our first woman questioner and the vice chairman of the Fed. And so I'll go with here, and then I'll come to you, Stanley.
Thank you. John, I agree with your assessment that it's great for people to work for a longer period, but sometimes I think our society is our worst enemy toward getting people to work longer. We've got a couple companies in Silicon Valley, I think at Facebook and Google, over 30 need not apply. I mean, there's basic hiring discrimination there. I've worked for companies where 40-year-olds get promoted, and if you happen to be 60, you're too old to be thought of as doing anything in the future for that company. That's advancement. I've got a 50-year-old son who's been CEO of a company here in Silicon Valley, and he's told he's too old to get another comparable job. So I love your idea, but how do you get past this perceptual barrier that being old is bad?
I'm not sure I know the answer, but I agree with you about the problem. You know, I've attended gatherings and conferences with employers and about the subject of working longer. And I would say most employers come to that meeting with the idea, if they want ideas of how they can get their older workers to leave the workforce. It's just the opposite of what I wanted to talk about. So I think we've been a little easy on the private sector. The private sector has a long ways to go on this as well. And it needs to be turned around and needs to kind of come to the idea that 60-year-olds are not what 60-year-olds were in the 1950s and so forth. They're younger, they're more productive, they have more to offer. So I think we need a big national conversation on this. Jim's chart is encouraging that, in fact, one way or another, the market has allowed people to work longer, but it needs to continue, and we need to have explicit conversations, I think, including employer groups like the Business Roundtable or something like that needs to take this up.
It turns out, you know, there's a tremendous amount of interest in questions around what you're describing, and one part of it, of course, is the social mores and the practices of business. The other is what's the empirical basis for these things. I mean, how do workers' productivities change as they age, and how does creativity change? You know, there's a recent study that some of you have probably seen written up on age of major scientific discoveries, trying to use that as a proxy for, you know, creative genius. And that actually, the age of discoveries has actually shifted up over time, from, you know, late 20s and 30s into 30s and 40s in many cases. There still isn't much in the way of great scientific discovery taking place after around age 55 in most of the fields. And, you know, what you make of that is, I think, a little unclear. On the other hand, Mercedes has done a big study in one of their factories where they've tried putting together teams of different age workers and looking at the productivity there. And what they found is that the youngest workers, those who were under 30, had higher rates of errors and other kinds of you know, poor performance generally defined, whereas the productivity for workers in their 50s and into their 60s was very flat, and you didn't see any evidence of a tailing off at that point. Now, you did have to find some clever solutions to problems like you might need brighter lights on the line than you used for your 25-year-olds, and it might need to do other things that accommodated the changing body and the changing skill set of your workers who are 60 to 65 to maybe 70. But these are things I think if we can get over the hump of getting people to realize, as John teed up, that this is something we do as a nation probably have to embrace. That there's a lot that can be done by the private sector to try and make good use of this part of the workforce.
How about this young gentleman who's looking for a job here?
Stanley, before you ask your question, in your Senate confirmation hearings yesterday, did they ask you how long till you retire?
I was waiting for that one, but it didn't happen. Steve, I have to just correct you. I've been trained for the last 3 months to say, if confirmed, the vice chair of the Fed. This is very much, there's retirement and there's work, and they're each, implicitly, they have the same value as they've always had. The relative price between them is given, and we didn't take that into account. My impression is that in retirement, there have been a lot of improvements in the technology of retirement. You can travel overseas more easily. You can hit a golf ball further. There are all sorts of things that have happened. Has anybody done any studies of the demand for retirement, you know, or the relative price of retirement relative to work?
I'm not sure, Stan, this is exactly on point, but I think it's related. There have been some studies of what happens to consumer spending when households go from the working to the retired period. And you know, this is an underpinning of a lot of these discussions about what's the replacement rate you need to shoot for. You know, is 70% of your income enough? Is 80% enough of your income? And there's heterogeneity, enormous heterogeneity here, and again, it's related to some of these health and related things. For people who end up retiring somewhat earlier than expected, 61-year-olds who encounter some health situations, whatever, they tend to end up spending a good deal less in retirement than they were spending before. On the other hand, for higher income households who retire on average somewhat later and are on average in much better health, there's actually evidence that their consumption spending goes up when they hit retirement relative to before, which I think is very much supportive of what you're saying, which is they are in some sense time constrained when they are forced to go to the office. And when you're able to travel and do all these other things, you actually, if you have the resources, the technology of retirement is actually pretty attractive at this point. Yeah.
There are studies, I'm not super familiar with them, I may not even be as familiar as some of you, of the phenomenon of unretirement, where people find that retirement wasn't quite the blissful existence that they expected. Or maybe the finances aren't quite as secure as they expected.
Or their spouses didn't find having them home.
I mean, in fact, some of you may have seen, there was an article in the New York Times yesterday called The Gray Job, which is about precisely this issue of the learning that goes on as people hit these retirement ages. Some of them discovering that, in fact, they're financially better prepared than they thought, and they can blissfully move into retirement earlier than they thought. Others discovering that either financially or for reasons that they missed their job, they actually want to get back into the game. And at that point, the questions the earlier comment raised of, what can you find at that stage become challenging. Older workers are, in general, do not search for nearly as long in the hunt for a job as younger workers do. There are relatively few 65-year-olds who've been searching for a job for 18 months or 2 years, whereas you do find that, especially after the Great Recession, amongst the younger part of the population.
There was a question here. No, you lost it over here.
I've been reading a lot lately that just given the demographics, the low birth rates, that there's really a pending labor shortage. I mean, to what extent will the market perhaps take care of a lot of this?
Well, I think the answer to that is that bodies are not the only measure of labor supply. Sal Khan is kind of the answer. You build human capital, and each worker becomes able to do more things. So a key response is likely to be the effective growth of labor supply on that margin. The other is what John talked about, which is that we can address that in part by keeping more of these older folks in the labor force, and that's a key concern.
Mark?
These lights.
Yeah, I can see people, but
yeah.
We only have one microphone person.
I have a question here. Over the years, the pattern of employment has changed, and it's not everybody works going to the office or going to the workplace. And nowadays, the more and more people are working online and remotely. Will that have any effect on the equation that you are talking about?
I think the issue with the question for those of you who couldn't raise it was, the nature of work is changing. The set of people who are using computers and IT in the office, in an office-based job, is rising given the nature of the U.S. economy. We're no longer seeing as many jobs that are physical manual labor. How does that matter? Some people have pointed to that fact and said it facilitates the longer working lives that we've been talking about this morning, because the amount of back-breaking labor and other things for which sheer physical capacity is declining. It may shift the things for which there is a priority to something different, right? To sharp eyesight, to speedy hand-eye coordination and things like that. So I think the jury is open in terms of how that kind of an occupational and industry shift is going to play out in terms of the capacity to expand working lives.
Mark, did you get the mic?
Yeah.
So,
yeah.
Jim, since your key theme was heterogeneity, and one of the questions raised was, how do you encourage older people, how do you encourage individuals to find the opportunities to work even if they wanted to work? And I think on the heterogeneity dimension, I think we need to acknowledge that there are industries for which marginal rates of productivity actually decrease with aging, and in some cases they increase. Probably wouldn't be such a great idea to encourage professional baseball players to work until age 70, for example. But so in that respect, part of the challenge is for those industries, and this probably characterizes a lot of industries, where marginal rates of productivity actually decrease. How do we deal with the kind of the social kind of dimensions to the wage schedule, and the fact that wages tend to be sticky in one direction, and there are certain challenges associated with acknowledging that pay rates need to decline in those industries where marginal rates of productivity decrease. So that's just one challenge. And I'll just make one last observation, which is for those of us who've been trying to recruit Jim Poterba to Stanford for the last 25 years, I just wanted to observe that Stanford's a great place to retire at age 60, Jim, for the next 30 years.
Your first point, that's partly why I suggested that we look at the labor market institutions in Japan. Because Japan, typically, you retire from your career job at 60, and then you get another job. And sometimes it's more or less the same, sometimes it's very, very different. So you might have been a computer scientist and then you end up a real estate agent. That's okay, and that's partly what I meant about retraining and so forth. I think the idea that you would stay in one career from 21 to 70 is probably unrealistic, but I think it's also, so anyway, I think this needs to be studied. I agree with you that productivity declines in many jobs with age, but in other jobs it might be higher. I mentioned real estate agent. I don't think I'd really want to buy a house from a 25-year-old real estate agent. I don't know if that includes any of you, but if somebody was, had a little seasoning, that might be a good thing.
It's a great question, and in some sense it tees up a whole set of policy challenges. But one way to think about it is, you don't necessarily need people with full-time jobs in this extended life, in this extended work life, because a key part of the benefit from the extra years of being in the labor force is there are two pieces, right? One is you are still earning and you can still save out of what you're earning. But even if you can't do that, even if all you can do is to delay the date at which you need to begin drawing down what you've accumulated, that's a big win too. Okay, so when folks are delaying Social Security, for example, what they're doing is they're getting a higher benefit from the system because of the actuarial recalculation, but their benefit rises because they're spreading it over fewer remaining years. So if you can find a way to get 3-4 years of part-time work for people in their 60s in a way that enables them to push out the date at which they need to begin their traditional, quote, retirement paydowns, that can be an important gain. Okay. It is striking to me when I looked at some of these numbers on labor force participation, I thought that the older workers, those in their 75, 80 plus groups, would be primarily part-time workers. But interestingly, there is still a lot of full-time workers in the men out in the 75 to 80, that group that I told you where you still got a 10% in the labor force. Most of those are actually full-time. They're not part-time, so they're not the folks who are just doing something a little bit on the side. But there is a lot of part-time work, especially in the 85 plus group. There, the part-timers start to become the dominant pool. But it does suggest a number of ways to tackle this.
Henry, if it's really quick, because we're out of time.
Okay, John, you had 3 suggestions for encouraging longer work, 2 of which would aggravate the shortfalls in social insurance systems. How would you pay for them?
So I think Henry's question, if you all heard it, is 2 of my suggestions would hurt. I take it you meant the paid up and the Medicare. So I don't actually agree with you on Medicare as a primary payer, that it would worsen the finances of the federal government. The issue is how would labor supply change if the net take-home pay was improved from working longer for 65-year-olds, say. 65-year-olds are much more responsive to pay levels than, say, 45-year-olds. 45-year-olds are going to work no matter what. You can tax them, they keep working. You can subsidize them, they keep working. They just aren't real responsive. 65-year-olds, hopefully for many of us, work is a little bit optional. And if it pays off, then I'll do it. If it doesn't, I won't. So I think there's a pretty high labor supply elasticity at those ages. So if we got more work because we went to Medicare as a primary payer, Medicare's finances would worsen, but the IRS finances would improve because you'd have labor income which would be taxed. And if you kind of do all the calculations, it looks like that change could be made without a net cost to the federal government. The other one, the paid up idea, again, it does depend on what the response is. If there's enough response, if we have enough more workers paying taxes, it doesn't cost what it appears to cost without behavioral response. So I don't think it's terribly expensive. It does mean, though, that the federal government would need to do something that it doesn't do much now, which is look at all of its pockets instead of look at its budget pocket by pocket.
John, there is the point that the trust funds are regarded as separate entities. They have to be brought into balance, and there you do have trouble.
No, I think that's fair enough.
We're out of time, but Secretary Schultz preempts our timing.
Well, I wanted to agree with John Shoven that we could learn something from Japan. But also, it's worth pointing out that Japan is basically an ethnically closed society. They don't even like Japanese brought up in some other country who come back. So they are very constrained. Their population is declining, and they see a need in a really vivid way. We can still learn, but like in our case, we have immigration, and we have all sorts of constraints. But I couldn't help but react to Stan. He said, as we get older, our drives go longer, and oh, do I wish that were so. My golf game, she has left me for a younger man. Sorry.
Yeah, I think that. Thank you, Jim. It was great. Jim, thank you very much. Yeah.